In this video, I'm going to talk about 7 mistakes you should avoid when caring for a child presenting with fever. Hello, my wonderful viewers. Welcome to my channel. My name is Dr. Cornelius. Please stay with me to the end of this video so that you can learn a lot of things. And if you are new to my channel, please hit the subscribe button and don't forget to turn on the notification so that you can get more videos from us. Before I dive into explaining the 7 mistakes you should avoid in a child presenting with fever, I want you to take note that fever is a symptom and not a disease. Okay, it is a natural immune response the body uses to fight off anything foreign that gets into it. Okay, or a response to injury or inflammation. Okay, now a child is said to have fever when the body temperature is 38 degrees Celsius, that is 100.4 degrees Fahrenheit or higher, regardless of whether the temperature is taken from the armpit, from the mouth, or through the anus. There are so many things that cause fever, so I'm not going to bore you with that, because even scientists have tried to classify fever to the extent that they came up with what they call fever of unknown origin, which is to tell us that there are so many things that can cause fever. Okay, so I'm not going to bore you with that. Okay, so there are things that you need to know so that you not make mistake when trying to manage this child with fever. Okay, the number one thing you should avoid, aspirin. Okay, don't give a child that is having fever aspirin, because you never can tell. There are 1,000,001 things that can cause fever, which I don't want to bore us with. There are so many things that can cause fever. It includes viral infection, bacterial infection, inflammatory inflammation rather. It can cause a lot of fever. Okay, so when this child have, you give this child aspirin, you don't know whether the fever is caused by viruses, okay? Maybe some influenza virus or varicella zoster virus or whatever virus. And then you give this child aspirin, okay? This aspirin can cause a damage, in the liver. The metabolites of this aspirin, or the chemical components of that aspirin, can cause a damage of the liver or the brain. Okay, they call it hepatoencephalopathy, which is a syndrome called Reye syndrome. Okay, that is what the aspirin can cause in this situation. So do not give a child that is having a fever aspirin. Although some people will look in their cupboard, they don't see paracetamol, they say, okay, this aspirin, you can use it because you use it in adult and it works. So don't give it to a child. All right, the third thing you should avoid when a child is having fever, don't give the child cold water, or don't make him get a cold water from the fridge, or try to get cold water and start bathing the child with cold water, or try to use a sponge and cold water and dab his body. It will help in a way, but what it does after you've done that, it makes the child to feel cold. The child will start shivering. Okay, when the child will start shivering, the brain will think that, oh, the body is getting cold, let me produce things that will make the body to get hot. Okay, so what you did is like you try to stop the fever temporarily, and then later on the brain now triggers another fever on top of the fever, so the temperature will get extremely high. So when you want to do this, some people say tebit sponging. When you get a sponge and then you dab it, it's a good way to reduce the fever, but you have to be very careful. You have to look for a lukewarm water, okay, instead of using cold water. You look for lukewarm water. So in that process, you can do that quickly and then wrap the child up so that the child doesn't feel cold, so that the brain will not think that the child is having cold and then try to release some things that will make him feel hot again. All right, the thing you should avoid is ibuprofen. Some people will be like, oh, okay, well, then what else do we give the child? Okay, this is not it's not generally, it's not a generalized stuff. Okay, this ibuprofen, you should avoid it specifically in children that have, that you know that this child have asthma. Okay, a child that have asthma, you should avoid ibuprofen or any NSAID. There's what a medication, class of medication they call NSAID, non-steroidal anti-inflammatory drugs. Anything that has NSAID, just avoid it. Okay, because it is safer to use paracetamol instead of ibuprofen in children that have asthma. Because why? This ibuprofen can cause bronchoconstriction. Okay, the component of that ibuprofen, when it is metabolized, can cause bronchospasm. Okay, which can further exacerbate the asthma in this child. Okay, you don't want to, you want to treat fever and then you exacerbate asthma. So try to avoid that. Thing you should avoid. I've seen some mothers in the local area where I come from, when the child is having fever maybe and is also complaining of chills, they will use, they will wear him double clothes, sweater, they wrap him up and all that. What you are doing, you are trying to make the heat to, in fact, you are cooking the child. Let me just use the word, you are trying to cook the child inside that clothes, because you need to wear the child a light cloth that is airy, so that the heat can be dispersing. When you overdress, you instead increase the body temperature. It's just like when you are feeling cold, you go and put on sweater. So you don't put on sweater when the weather is hot, or maybe when you are from jogging, when you went to run 100 meters race, and then you are panting and sweating, then you, instead of you to take off your shirt, you go and wear a suit and a sweater and cover yourself. That is exactly what you are doing. Okay, so it's not right. Then you should avoid, like I said earlier, fever is not a disease. Okay, do not try to treat the fever immediately or quickly. You have to monitor the child. Okay, try to monitor him, monitor the temperature. Just leave him, because maybe the fever is a way that can stop whatever that is foreign in his body. Maybe it's a bacterial infection, or maybe it could be viral infection. Just monitor him and make sure the temperature doesn't rise to the extent that he will go into convulsion. Okay, so you have to monitor the child. And then when a child is having fever, do not delay to seek delaying seeking medical attention. Some parents will be like, okay, I've given him paracetamol and the fever is just it has stopped, and then you don't want to take this child to the hospital to find out what is really causing this fever, because it could be an infection that needs urgent treatment, but because of the delay now, the infection may have damaged something. Or let's say the child is having meningitis, or having otitis media, maybe ear infection or sore throat. You don't know, you just give the paracetamol, the fever is okay now, but you don't know the after effect if that infection is not treated. So anytime your child is presenting with fever, try to take him to the healthcare facility immediately. Maybe if you give the paracetamol for a day or two and the fever is still continuing, maybe then you have to take the child to the hospital. Don't waste time, okay? Because when you waste time, it can it can lead to something very serious. Okay, so this is the end of the video. I hope you've learned something today, and if you have not hit the like button, hit the like button, okay? Then subscribe to our channel if you have not subscribed, so that we can be bringing more content for you. Thank you very much and remain blessed.